questions here that we want to ask opinions of these two wonderful doctors. Somebody has written in and said, we haven't told our son about his diagnosis. Earlier this week, we had Exceptional Minds on, and they said the summer program at Exceptional Minds looks fantastic. But if we send him there, it's a given we have to tell him. Everyone in the family, extended and husband, are against telling him. I've started to leave my autism books out. Good or bad, my son doesn't care about books. Your thoughts, and thank you very much.
Okay. So my initial thought is just it's a personal preference as to whether or not you want them to know. And I think there's pros and cons to telling and pros and cons to not telling. So maybe we could give a few of those.
Yeah.
I don't think necessarily, is the age of the child on there?
I believe, if I'm right in knowing this child, that they're a young teenager. So I think around 13.
So, it could be the type of thing where this child has always thought something's wrong with them or they feel different, and maybe it'll be a relief for them to know. It could be the opposite, where it would devastate them. So you want to think about those possibilities. If you send them to this mind place or whatever in the summer, Exceptional Minds. Mm-hmm. They'll probably figure it out, but also you could say, they're going to work on certain things there that you have similar characteristics of. Like, I actually have a client where they will be bringing their 17-year-old to our center, mm-hmm. and it says CARD, Center for Autism Related Disorders, but don't want him to know that he has autism, and I was kind of concerned about that, but they were okay with me saying, yeah, we're actually just coaches and we help people, and we started out as an agency that helps autism, but at the same time, there's a lot of behaviors that we help, and so, it's not just people who have autism, but you have some similar things that are, related to that, so we're going to help you as well, kind of a thing.
It's a good point, and I do think that at Exceptional Minds, they have individuals who have other things besides autism, and I think there's a way that you could get away with sending him and not telling him.
The only problem would be is if it's super transparent and he'll just feel you're lying to him, and then he's not going to trust you. So kind of you have to weigh all these kind of things and figure out.
There is that. I really feel like it comes down to personal preference, but it sounds like Mom is getting to the point where she's ready, and that's a good thing. That's a good thing to acknowledge and know that you're ready. It sounds like there's a bunch of other people who aren't ready, but what I don't know is the individual ready.
Right, and I've actually talked to a lot of young adults and adults on the spectrum who specifically said, I'm glad my parents told me, because I always wondered why things are so much harder for me than they are for all the other kids in school. And so I think that if you make that choice, that personal choice, that it is time to talk to your child about it, that I think that the way that you talk about it is just absolutely critical. And there's a real consistent pattern in our culture of talking about how disorders cause things that is really, really bad and really insidious. And so I think we want to really avoid that. What a normal, real common thing to do would be like, oh, I have autism, that's why X, Y, and Z. So I have autism, that's why I can't make friends. Or I have autism, so that means I'm stupid. Or I have autism, so that means there's something wrong with me, right? Mm-hmm. When in fact, autism is a name for a wide, very dispersed collection of challenges and strengths, right? And that every kid is different. And that in each individual child's case, autism maybe is the label that gets put on the fact that you have to try a little harder to pay attention to stuff, to pay attention when other people are talking. For some people, it's really easy to pay attention. For others, it's harder. Kind of like in the way that, a short person, they can play basketball. It's going to be harder, Yeah. It doesn't mean they have a disorder. It doesn't mean they should feel ashamed, right. a non-basketball disorder or something. It just means, I'm going to have to work extra hard, Right. So same thing with me. I'm a terrible dancer. I'm sure I could learn how to dance if I wanted to, right? But it would take 10 times the amount of time to learn how to dance as compared to someone who's more gifted in that way. So I think if we think about it in terms of that, rather than here's this bad thing in my brain that makes things happen, it's just a descriptor.
Yeah.
And it's not a positive or negative, it's just a name for different types of challenges, and that everyone in the world has challenges. Absolutely everybody.
Yeah.
I think the last time they looked, something like 30% of the population could get a diagnosis in the DSM. In other words, it's just normal. Nobody's perfect.
Right.
Everyone has challenges. And
absolutely.
So I think that's a good sort of perspective to discuss it from.
Super advice. And